So, how do you demonstrate that you are on a super duper TRT protocol? Is it how you feel? Is it the quantitative markers? Is it a smorgasbord of all of these things? Now, obviously, you presented to the doctor because you had symptoms of low testosterone. So, the primary symptom is cognitive decline and a change in your mental state. So whether that be low mood, anxiety, a sense of depersonalization, they're the two main things that people present with. So psychological things, they're quite difficult to quantify. You can do questionnaires, but how do you feel? It's a hard one because there are so many external factors that can contribute to your sense of well-being. If you're trying to demonstrate to somebody that your testosterone replacement therapy protocol is optimal, your numbers are optimal, how do you do it? I feel great. Well, I feel great because my levels are now optimal. Now my diet's in check, and I'm now exercising. So which one is it, chicken or egg? It's hard. We are obviously super thrilled to hear that you feel great, but we want to do more. So how are we going to affect a change to how others practice? We can continue to grow the men's health clinic, and we will, so that we will have clinics nationwide and hopefully international clinics. But how are we going to demonstrate to the powers that be that our protocols are effective, safe, and something that should be replicated by the NHS? I feel great. I feel wonderful. My guy today said I feel terrific, and it's like, that's brilliant. I'm absolutely thrilled because that's what we want. We want these guys who have suffered to feel amazing. But it isn't as simple as saying your testosterone levels are amazing. Why aren't you feeling amazing? There are plenty of guys out there with normal testosterone levels who feel terrible. And it's not because of unrealistic expectations solely, it's because they are not given the right tools to take their optimal testosterone levels forwards. So we always highlight the importance of a healthy lifestyle, nutrition, and physical exercise. But they need guidance sometimes. And so is it chicken or egg? Is it the fact your testosterone levels are great and that's allowed you to exercise? Is it the nutrition? So it's a smorgasbord of factors that help contribute to your sense of well-being. But we need to demonstrate to the NHS that our protocols and that our way of working is effective. As you know, we microdose. So we use the minimum effective dose in the most appropriate fashion to achieve our desired outcome. And that's a steady physiological state, homeostasis. So to help facilitate that, you want to avoid peaks and troughs. Hence, we use small doses frequently. So how have we demonstrated that our protocols, our way of working is the most effective way of working? Well, there are blood parameters that we can look at. So obviously what we want to do is to keep our guys within the normal physiological parameters. The only exclusion to that is guys with high SHBGs, because those guys do need a higher total testosterone than would be considered normal by the NHS to release free testosterone. So that's the only parameter that actually is outside of what would be considered normal. So SHBG is interesting. I have spoken about this before, so I won't go on ad nauseum about its role. But we have found with microdosing, the low SHBG guys do often see a rise in their SHBG. We had a guy come from the NHS who was on Libido and his SHBG was less than 2, and through microdosing it's 28. One Men's Health Clinic, NHS 0. So yeah, we can demonstrate an improvement through increasing SHBG levels with the low SHBG guys. What else? Now we do know that obviously free testosterone or excess free testosterone can raise hematocrit to mean that you feel sluggish, and you don't have that sensation of well-being. So we do find that when we microdose, we don't get that significant rise in HCT, so hematocrit, that people do with more traditional protocols. So not many of our guys actually have to donate blood because we are as close as damn it to normal physiology, and that's what we're trying to achieve. So HCT, that's another parameter. What else? I mean, the obvious ones about free testosterone. As you guys know, I like my guys between about 0.45 and 1. The reference range has changed. We haven't changed as a species, so that just indicates that the natural population is sicker, which is quite alarming because our DNA hasn't changed. So I like my guys between 0.45 and 1, and that's where they report to actually that qualitative improvement. Above 1, everybody has anxiety. And the Americans who advocate high levels and high numbers, they're all anxious, aren't they? Give me strength. So what else? Well, we've invested in the InBody 770, which is a medical grade body composition analyzer. And we've done that to demonstrate some physical changes that can occur with testosterone replacement therapy. So alongside the qualitative and blood markers, we also want to demonstrate other parameters that can change with optimized testosterone levels. So namely, lean muscle mass. We've said it before, testosterone replacement therapy is not about gains in the gym, it's about normality. But if you put the hard work in, if you eat properly, you can optimize your physical performance, and that would increase lean muscle mass. Visceral fat, the dangerous fat. So we want to demonstrate that having an optimal testosterone level will decrease your visceral fat content. We want to demonstrate that it will also decrease other parameters, such as your percentage body fat, as long as obviously you do the right things: diet, exercise, and lifestyle. So there's also something very interesting called the phase angle. Okay, and this is essentially how the beams jump off the or deflect off of the cell membrane. So I've got a score of 7.2. So I'm gonna live forever. No, I'm only joking. But they do use the phase angle in intensive care units. So the phase angle score is actually quite fascinating. We have an overall body score. So mine's 99 out of 100. So nobody so far has beaten me, but I do have a few worries about some guys who I think are going to come in and trounce my score, because you can get over 100, especially if you're muscular, because everybody starts off at 80, and then you obviously get more points for more muscles and less points for more body fat. So yeah, we want to be able to demonstrate the effectiveness of microdosing, the effectiveness of being under the care of a clinician who has a holistic approach to testosterone replacement therapy, because after all, testosterone affects multiple organs. So it's okay simply optimizing your testosterone levels. Is it job done? No, it's not job done actually, because you have to think about all the other issues or elements towards health, and a good clinician will address those. So we do have some exciting news that I'm not going to tell you right now, but just understand that at the Men's Health Clinic, we are constantly working to improve the service that we offer you and the holistic approach that should be adopted as a doctor. So whilst I do specialise in testosterone replacement therapy, I want to see you as a whole, as a package, and make sure that we address all aspects of your health and we improve not only how you feel but the physiological parameters that go along with health. So it is boiling, so I'm going to go out and sunbathe. Have a nice day, guys.